Macular degeneration is a breakdown of retinal layers specific to the macula, the retinal pigment epithelial layer. When it's the dry version, we start to see little yellowish deposits, almost like little bumps, little texture change back there. We call it drusen. That would be more in the dry form. When there's the wet form, we start to see breakdown of layers and new vessel growth that stem from trying to get a breakdown of nutrients there and trying to, this blood vessel growth forms, trying to stimulate more nutrient and a breakdown of that layer, then, start to get these vessels grow, and those are weak and they leak and they bleed. So many of the treatments are geared towards trying to stop the stimulus to that blood vessel growth. There are a lot of new things coming down the pipeline for macular degeneration. So first of all, with macular degeneration, we can get into looking at whether we're treating dry or wet. And for wet macular degeneration in particular, we started off with injections being some of the newer things, injections of medications, Eylea, Avastin, Lucentis, to stop some of that blood vessel growth and bleeding and leaking of fluid into the retina. And we were doing those on a monthly basis, sometimes 4 to 6 weeks. Some of our goals now are to try newer medications to try to elongate that time. So changing the medication structure and molecules to try to elongate that time in between injections. It's definitely one of the things on the forefront now. Also, instead of changing the molecule, now we're looking at also how do we change the delivery system. Instead of routine injections, can we put in a port system?
What are the signs that that's coming on, and what should people expect with their vision?
When macular degeneration occurs in its very early phases, you may not notice much at all. And that's one of the biggest reasons we are advocates of routine eye exams. Then when we start to see those signs, we can do portions of exams, some special tests called OCTs or scanning lasers that will show us where exactly those drusen are, if there's fluid leaking in different retinal layers, and just how involved things are. It can also allow us to watch for change over time. So the expectation would be to definitely expect exams at least yearly, if not more.
Sunglasses for that issue. Is there something you recommend there, or kind of how that can help that?
Absolutely. We know that UV exposure is one of the biggest things to kickstart progression with macular degeneration. So good UV protection, good sunglasses, whether it's summer, whether it's winter, we know can be one of the best things that we can recommend. So for summer, obviously the sun is out, but for winter, we tend to forget about things like that. But the sun is reflecting up off the road surfaces, off snow. So you're still getting that light through into the macula. So really anytime you're outdoors for any amount of time, good UV sun wear is definitely recommended.